That means that the spinal cord here is completely exposed to the fluid around the baby. It is pulling the brain down, preventing
being on duty to their patients, and they do so with passion and compassion.
We discovered a problem with the baby's spine and spinal cord. We were placed with many options in front of us.
They work not only with practical compliance and competency, they also work with a lot of passion and compassion. The nurses really go out of their way to make parents and the little ones thrive through the whole process and the whole stay of in the unit. The NICU nurses will think about the parents' emotional status before anybody has to tell them about that. When a baby is admitted in the neonatal ICU, the nurses will go and get the mother's cell phone or mobile phone in the department to give her a photo of the baby or a video of the baby so that they can know and they have the reassurance that the baby is really alive and well. Because whenever a mother falls pregnant, they never think that the NICU will be part of their life, and it's a place where not many people go. So when they come into the NICU, they sometimes feel overwhelmed and they feel like it's an insecure area that they feel very scared. The other thing is, if a mother cannot come to the unit and we cannot take a photo or a video for her, we will go as far as to push the mother in a bed to the neonatal ICU. Now, these nurses do this without thinking twice about it and without having been to be told about doing these things. There are many interesting cases passing through the NICU, and for the babies and the parents, the nurses are always ready to listen with sympathy and some with empathy, because funny enough, I have 2 nurses whose babies were in the NICU. They also ensure that parents are continuously updated, especially after discharge. They will give the team leader mobile number to the parents, and they can call any time of the day or night to ask about their infants. After discharge, we also go the extra mile to make sure that they are okay at home. We will phone them after 24 hours, and again at 48 hours, and again at 72 hours to make sure that they are okay, and to make sure that they are aware of their follow-up visits, to make sure that they are coming back to the allied health services, which is very big requirement for our babies. Mr. Tahir is going to tell you about his department. He's the service line administrator of the bone marrow transplant unit and oncology. And he will be the best person to tell you about his department. Thank you for listening.
Thank you, Mary. Thank you, Mary, for presenting me. Actually, so I'm so happy that for today I will talk about paving the road for hematopoietic stem cell transplantation in UAE. This is a single center's experience from nursing perspective. It's not working. Not working. The slides. Okay. Okay. So actually, for hematopoietic stem cell transplant, as you know that it's critical and complex a procedure requiring specialized nursing care, recently established as a viable treatment option for hematology and for non-hematology. This center actually started in 2021. Like expanded for adult and for pediatric transplant, autologous and allogenic. So BMT unit in a Burjil Medical City actually like exploring single center experience, and also the pioneering efforts in setting up the first comprehensive adult and pediatric hematopoietic stem cells in the UAE with a capacity of 13 beds standardized as per the EBMT guidelines. So actually the cornerstone of the nurses in the bone marrow transplant, they are playing like a crucial role in integrating, managing pre-transplant from the BMT workup about doing the pre-BMT workup journey for the patient, and during the pre-transplant with like given high dose of chemotherapy, and also during the transplant journey after infusion. And this is only like post-transplant complications. They are playing pivot like role in monitoring patients from complication and managing their symptoms effectively. Others, I'm talking about the role of nursing in the training. I'm talking about also the upskilling program for nursing. So nurses undergo for a special training program that specializes in BMT care, including understanding complex chemotherapy protocols, managing side effects, oncology emergency, symptom management, and also they have special experience in how to like identify graft versus host disease for different skin, liver, and other organs. So actually for other rule for the nursing staff in BMT unit, they are supporting emotionally. As they are doing the emotional and psychological support, nursing provide holistic care, emotional support to patients and families, helping them navigate the psychological challenges associated with bone marrow transplant. Actually, once I'm talking about the challenges part they are facing during start in October 21 that we have a limit in specialized nursing and bone marrow transplant in the market. And in addition for that, the competitors also in the market from different hospitals. Other than that, we have like some issues regarding the technology. I'm talking about that we need to integrate or adopt a special technology regarding like BMT Plus program or special programs and modules that can actually deals with bone marrow transplant patient who is undergoing autologous and plus allogenic. Other than that, the pressure. The nurses actually in bone marrow transplant, they are experiencing pressure to maintain high standard of care. This is in highly specialized and demanding area of medicine and symptom management. Okay, this is just, I like to talk about, we have many successes during our journey. As we now like completed 125 cases, so like we have around 66 for pediatric, other cases for adults, alhamdulillah. Once I'm talking about the success rate, I'm talking about like 92%. We have like less mortality, morbidity during our journey. So actually this is one of the most memorable involved 7-month-old baby diagnosed with ALL who underwent allogeneic transplant with fully matched sibling donor. This patient, she was among the first 10 patients received in the BMT unit and the youngest. Her diagnosis and young, actually this is one putting the mother as she experiences like depression during the phase of admission. The nurses, they played a crucial role in supporting the mother and also supporting the patient himself regarding physiological and regarding the psychological. Actually for the physiological, we are talking about maintaining high standard of care by ensuring continuity during the nadir period. Patient experience severe mucositis, GI toxicities, and also fever, sepsis. Patient, alhamdulillah, engrafted on day plus 20 post-BMT. And the patient, alhamdulillah, now recovered. We are talking about 2 years post-BMT. And the psychological domain, as nurses, they are playing a pivotal role in supporting both the mother and her baby throughout the transplant journey. They help the mother care for her baby daily and minimize both of their pain and suffering, actually by using the distraction techniques with her baby. So this is like by using the colorful toys and also the sound. Actually, from our part as nurses in Burjil Medical City, we have the future direction regarding education, as we are now adopting a new education material from the Elsevier, from bone marrow transplant, and introducing an oncology upskilling course that spans 3 months. Actually, this is, I'm talking about Burjil holding level. In addition for that, we are implementing journal club activities to ensure about nursing level and promoting the culture of evidence-based practice among nurses. Other than that, we are working regarding advancing the BMT services. Regarding now, we are working in the process to get the JC-FACT accreditation for our center. Thank you so much. Thank you.
Thank you, Mr. Tar. This was really informative. And it's good to hear success stories coming from a hospital, especially in the department where you are. I'd like to give the mic to Amira Al-Kateri. She's the service line administrator for the liver transplant department. And she's going to tell us about her department and what her nurses do.
Thank you so much, Mary, and welcome to the booth. So in the liver transplant department, our nurses are really instrumental in every phase of the transplant journey, from assessing the potential donor to coordinating the post-operative care. So all the patients are coming to us. They are really VIP. We know that they are really scared and they are anxious. They don't know whether this procedure will be successful or no, what is the post-complication. So it is very important. The nurses are really making sure preparation mentally and physically of our patients are met. They are really standing with the patients, making sure that the multidisciplinary team, when they are deciding to have this kind of cases in BMC, they will sit together to make sure that they are physically and mentally prepared. Our nurses are up to the skill. We are making sure that all the skill that it is needed for such cases are met. So until now, I'm very happy to announce that we have a successful 3 patients, a liver transplant in BMC. So our nurses are playing a very, as I said to you, vital role. Ensuring that their physical and emotional needs are met throughout the transplant process, through their collaborative approach and commitment to the excellence, they contribute significantly to the success rate and the long term of the liver transplant recipient. So it is very important from our nurses to make sure that the pain management is up to date, up to the expectation, because when the patients will come from the ICU, they are extubated, they are still disoriented in the units, so the nurses will sit with the patients and the family, making sure that the care of the plan is explained well to the family and etc. That's all from our side.
Thank you, Amira. Liver and kidney transplants are a strange field to me, but you've thrown a lot of light on it, and thank you for that. We have decided initially that we're going to talk about 3 specialty departments, which was the liver transplant, bone marrow transplant, and the neonatal ICU. But we should never forget about the other nurses in the hospital that are contributing to good nurses' care and to good patient care as well. So we have invited 2 of our bedside nurses. Both of them are Emirati nurses. In the last year or 2, there has been quite an evolution in nursing, in the field of nursing, where our Emirati nurses have become a big part of our bedside nurses. And they are really contributing towards a lot of issues that us as expats cannot always maybe 100% understand. So I'd like to invite Fatima. She works in the postnatal ward, and Fatima, welcome to the stage. Thank you for joining us. Fatima, I would like to find out, we would like to know how do you think you as an Emirati nurse can make a difference to the patients, not just only Emirati patients, but also the other patients?
Thank you, Mary. I'm pleasured and honored to be here with all of you guys. So first of all, as any other nurse, I have to make sure that all of the patients meet their physical needs. So starting with the basic physical needs, the triangle that we all know. First of all, from our side as nurses, especially in my department where I work in, which is the gynecology and the obstetrics department, it is happiness, but it's not always happiness, and that's what people really don't understand. So first of all, we have to make sure that the patients are getting their basic physical needs, like pain management. And pain management doesn't really always have to be medication. That's what really people think about, that pain management is always medication. But really, people just want someone to listen to them this is a part of healing. This is a part of the healing process. So me as a nurse, I would like to connect and listen to my patient whenever they need, whenever they want. Sometimes they really wouldn't speak, but I have to recognize because I'm the nurse. And one of my parts and one of my duties is being an advocate for my patient. I have to take care of my patient. Another part of the physical needs that the patient need, which is really unrecognizable, but education. Sometimes us in the healthcare, we don't really think that the patient needs education just because we are educated. This is our daily life. This is our daily job to get to learn something new. But for them, it's actually something new. Sometimes people get hospitalized for the first time and they don't know what's going on. They don't know who am I. They don't know what's happening. So me as a nurse, I have to educate the patient because education really is a part of just letting the patient go quickly home. And actually, as a nurse, I would like to say proudly that I deserve to be told through health and sickness more than husbands. Because we are really, especially in the obstetrics and gynecology department, as I said, it's not always happy. Sometimes mothers lose their children. Sometimes women undergo through surgeries like hysterectomy, which is a removing of the whole uterus, something of a woman's body that some males wouldn't really understand, but it's really critical for us as females. So standing up for each other and just having someone to listen to, that's where the emotional aspect of the nursing comes, where we always have to provide emotional support for our patients. Sometimes patients would have gone postpartum blues, which is post-delivery depression, and the symptoms aren't really recognizable. Sometimes we would say, oh, she's crying just because of pain, and it's not really like that. Postpartum blues is much deeper than what we think. And that's where our role comes. It's not just medication, it's not just assessment. It's actually having to be there and listening for our patients, to assess patient, but to also be there when they need us, to let them speak, to let them let out some of the things. We have a hadith in our religion which says, قَدَّرَ اللَّهُ وَمَا شَاءَ فَعَلَ, which means what God has planned for us is the best for us. What God wants will happen. We have to accept it with an open heart, and we have to accept it and to believe that God has always better plans for us. And that's what I have to say as a nurse. Thank you.
Thank you so much, Fatima. You have reminded me that as managers, we should always remember that bedside nurses still see things in a different light than us, and that we have to value our bedside nurses for the roles that they can play in our patients' lives. Anadi, you can come across the stage. You're also one of the nurses in one of the inpatient departments. It's 6A, right? You're in the surgical ward. Could you tell us how you see yourself as an Emirati nurse and the role that you can play in the patients' lives in your department, surgically, pre-op and post-op?
So first of all, I'm honored to be standing here on behalf of my colleague nurses. We as nurses, we are giving an optimal care to our patient, whether it's physically, mentally, or emotionally. As we all know, wealth is health. Wealth is health. So healthy soul, healthy mind, healthy body comes to a healthy life. In a surgical ward, we are trying to combine all of it together. Our role is to provide care before, during, and after procedures. Most of it, we are doing care plans to our patient, whether it's pain, assessing the pain, whether it's anxiety, whether it's prevention of an infection. These care plans are based on the patient's conditions. Us nurses, also, we need to give an empathic care, which means seeing, understanding, and sharing other points of view without being judgmental. I'd say empathy is the heart of a good nurse. We want our patient to be satisfied, so we try our best to give them the care that they need. And as an Emirati nurse, I'd say patients and visitors would definitely be proud that there is an Emirati nurse on the floor. But for us nurses, we'd say patient to patient. Patient is a patient. So we need to give the maximum care that they need. And this is what I'm.
Thank you so much for reminding us that patients are all there because they need care. And this is the common aspect of all of our jobs. We are there to deliver care, and it's the common aspect of patients who visit our hospitals. They come because they require the care. We will allow time now for some questions and let the panel and answer.
Bring the microphone over to you for the first question.
Good afternoon. Thank you so much. It was a great talk by all of you. But I have a question to Amani or to Fatima. Can you just tell us the difference between your evolution as an young nurse? One of you can speak about an young nurse coming to a private sector. How was your evolution into the nursing practice? And one of you can answer, when comparing it with government facilities. Your friends are working in other facilities. What is the difference that you are feeling at Burjil Medical City or at Burjil Holdings?
Thank you for the question. I'll not lie to you. Coming to the private sector was a challenge. It's not really acceptable. But Amani and I have graduated together. We didn't choose the easy way. We wanted to do a challenge. It's, we're still young. We still have a life ahead of us, inshallah. So we wanted to choose the private sector because we wanted to learn. We had our clinical placements in government sector. We know the way, we know the workflow. So we thought, why don't we pick another way? Why don't we pick a new way, pick a new adventure? And it is an adventure. We learn new things every day. Our work and our teams are great. They let us go into courses every day. My nursing supervisor is here. She's the best. But really, honestly, so we just wanted to learn something new. Our friends are in the government sectors, and they are attracting us each and every day to come. But we just want to learn. We just want to learn. We have, nursing field has a variety of different directions, a variety of different fields inside the nursing. But for us, we just want to pick something new. We just want an adventure that we can get used to and learn from. Thank you.
Thank you.
Thank you, Fatima, for that very wise answer. And I want to thank actually every Emirati nurse that's working in private sector and in the government sector for adding value to our hospitals and our facilities. I think we all were wondering how it would be before you joined, and I think we have all been pleasantly surprised. I can see Amira is also nodding her head, and she must be agreeing. Any other questions?
If there are not many other questions, then again I have questions to the leaders, all three of you. We know the greatest challenge in nursing, that too in Emirates or United Arab Emirates, is the turnover of the nursing staff. And you are getting a lot of young nurses, new nurses to the country who really don't have that experience or expertise that you required to practice in your area. So can each one of you can mention about what are the exact nursing programs that you do in order to develop your nurses?
Sure. I can start by saying I think the three of us will be in agreement that general nursing orientation is something that they all go through initially to familiarize themselves with the company and with the policies. In the NICU itself, we have a micro-orientation program where we really walk the road with the new nurses so that they don't get scared and they don't run away. We put them next to a preceptor. We encourage them to ask questions. We encourage the preceptors to work with them, to guide them and to always be there for them. My policy in NICU is that it's always an open door. If the door is closed, if somebody's crying there, respect it. Whether it is a mother, whether it is a nurse, whether it is me. But somebody is crying there. Once the door is open, it's always open and it's always available. even when I'm off duty or when you are off duty and you require assistance, we will always be there. And I think we have to make it clear from the first day that we are there for support, and it's not just the mental support and the educational support, but it is also for out of the hospital routine life to give them.
So
Mary.
I will ask another question in such a way. What is that extra X that you have in Burjil Medical City in order to attract the nurses who are coming in UAE or a job aspirant?
So aside from echoing Mary, what she said, I always have this concept in my life. Treat each individual person as part of your family. So if the nurse will come to BMC, I will treat her like one of my sisters. What I will do for my sister, for her to make sure that she is competent on these things, I will do the upskilling program. I will empower her with the education and knowledge that she will need in a way that she will try to adjust her life in the BMC and in the operation things. So I believe that if you empower your staff with the education and with the skills that she will need in her units, she will be very vocal in a way that she is confident in this area, because we nourished her with everything that she needs. That's really what I really believe. And sorry, I will just add one more thing. If you will just come and see our department, I believe, BMT, in ICU, and in the inpatients, medical and surgical, each one of our nurses are really competent in their individual, and we are doing a cross training also as well. So in case that Mary, she will need one of our nurses, we will make sure that her competency is completed before she will go. We will not compromise the patient safety. So that's why when we are pulling the nurses in between the unit, we are confident. No one will say that they are really afraid or they are really scared to go and they are in the same time vocal. They will just speak up that I am not competent in this area, and I need somebody to give me a competency or upskilling in this program.
I can also vouch for that.
Yeah, from my side, I'm talking about as I have an experience in bone marrow transplant and different now hematology oncology. The most important for any leader should be visible, should be accessible all the times, and always should be in every day in the clinical area in between the staff. Mentorship is very important. Guidance is very important. You should have access for the staffing, not only in your office. You should have monthly meeting for them. You should have they can come anytime. They can talk to you directly. No need to put any layers in between. This is from my side. I'm feeling it's most important.
Nisreen, you have a question?
I just would like to ask maybe Tahir about the bone marrow transplant.
Yes.
Since BMC was one of the first entities that started this program, which is very complicated, very complex program. So you as a leader for BMT program from nursing perspective, can you just take us through some points of the challenges that you have faced at the beginning and how you instrumented the innovations to facilitate it?
Yeah.
Thank you.
Actually, in the beginning, we are just facing an issues regarding recruiting staffing who has the background hematology, oncology, and bone marrow transplant. In the beginning, actually, we recruited some nurses. As other hospitals, they are competition recruitment, the nurses. So the most important from our side to recruit nurse bone marrow transplant with hematology oncology. This is an easy for us in case if we need to flow the nurses to others. Other than that, we are focusing on the education program, upskilling program, as I recruited ICU nurses. I'm talking about this is, I consider it as one of the success. I just recruited 5 nurses from ICU background. Actually, I focus on them to do upskilling program, oncology, chemotherapy, oncology emergencies, symptom management. 2 of them now, they are playing a role of the team leader also. So I'm feeling proud to talk about, not only all the time we need to recruit a nurse who is already skilled in the bone marrow transplant or oncology, hematology, no. So it means that we can start from other fields. If you don't have a nurses, you can recruit, but you need more focusing regarding educational program, upskilling program. It will take time, but it will have the good outcome.
We've got one more question from the floor.
One more last question. I just would like to ask your team as team leaders, what is your program for communication that you are planning there to improve the communication, which we know that it's the challenge of nursing and medical healthcare provider? Thank you.
Well, I can start by saying that we've rolled out a program. If it comes to the vocality, the verbal communication, we've rolled out a program throughout the NICUs about soft skills in communication. If you look at the other side of communication, if how you want to get communication or messages communicated to the rest of the team, we are communicating through handover, team leader to team leader, and the whole team together. We have using the SBAR, and we're also in NICU having a daily multidisciplinary team discussion, where everybody involved with the care of the baby will get together, discuss the treatment plan, and discuss the discharge plan from the first day. Because then everybody knows exactly what the plan is for each baby, and nobody deviates from it unless it's really necessary.
Well, thank you very much for that. I think that wraps up our conversation for today. Thank you very much for our panelists today.
Thank you, everybody, for listening to us.
And we'll be moving on right after this. Thank you very much. So our final pediatric care.